Just going to introduce myself. My name is Dr. Zishan. I'm one of the general physicians at TruDoc 24/7. Today, we're just going to be briefly talking about thyroid functions and what are the clinical signs and symptoms of hyper and hypothyroidism. So, what we're going to basically discuss is what is the function of the thyroid itself? Where is it located? So, thyroid gland itself is a gland that's basically presented and it's in front of your neck, right? Let's move this on the side. It's below your chin, above your trachea. So, it's like a small little gland that basically produces thyroid hormone. One of the functions for the thyroid hormone is that it's basically a metabolic hormone. It produces usually at nighttime. And I want you to look at this presentation, this slide, if you guys can see this. This is basically the hypothalamus, the pituitary, and this is the thyroid gland. The thyroid gland is just in front of your neck. Okay, it's like a small little gland, two glands, and they produce thyroid hormone. We have this within our brain. We have two basically glands. One is the hypothalamus. This is very important because this secretes the thyroid releasing hormone. Um, this is a pituitary gland, and then you have the thyroid gland. I want everyone to look at this presentation very clearly, okay? The thyroid gland secretes the thyroid hormone, right? So whenever we go to the doctor does a TSH, right? And then he does a T3 and a T4. In order for you to understand what's going on, I'll explain to you very briefly why we need to understand this. When the thyroid gland doesn't secrete enough thyroid hormone, this gives like a negative feedback, okay, to the thyroid pituitary, which secretes the TSH. So whenever we go to the doctor and he does a TSH, when this is high, the pituitary gland is secreting too much of the TSH, which is a thyroid stimulating hormone, right? Then we have the hypothalamus, which releases the thyroid releasing hormone, right? So this is like an axis, okay? Hypothalamus, pituitary, thyroid axis. If there is an increased production of thyroid, this will give a negative feedback to the pituitary gland, right? And to the hypothalamus that look, the thyroid is too much in the blood, and it gives a negative feedback fashion to the pituitary or the hypothalamus. Um, One of the factors that basically does come into play is that if someone has a autoimmune disease, autoimmune disease is when the body produces antibodies and it starts stimulating the thyroid, not through the hypothalamus or the pituitary itself. So it's going to start secreting enough and keep on stimulating the thyroid gland. Either if you have a high hypothyroidism, meaning less of the thyroid. So if you look at, sorry. So if you look at the thyroid gland, it either produces too much of the thyroid hormone, which is called hyperthyroidism, and either it's hypothyroidism. Then you have the thyroid nodules and if you, God forbid, if you have cancer. As I just mentioned in the last slide, if there is too less production of thyroid, you will have hypothyroidism. Hypothyroidism means less of thyroid in the body. One of the signs and symptoms of hyperthyroidism is that it produces too much of thyroid hormone. Um, if there's too much of hyperthyroidism, what will we see? As I told you in the beginning, when we have too much of it's a metabolic hormone, so you will basically start having signs and symptoms of unintentional weight loss. One of the signs and symptoms when somebody does present to you in the clinic as physicians, we basically ask them, they come to us and they'll be like, doc, we're having too much of weight loss. We're eating enough food, but we're still having too much of weight loss. Um, all this. Can you guys all see this slide? When someone has, as I mentioned right now, is that if somebody's having too much of weight loss and they're eating perfectly fine and they're still, losing weight. Yeah, slides are visible. Thank you. So other signs and symptoms are patients can start having, rapid heartbeat. So when you're sitting down regularly, they'll feel that they're having too much of, tachycardia, which is a rapid heartbeat. They'll eat more. They'll feel nervous, sweating. Um, you also have like muscle pain, proximal myopathy. Um, Some patients with hyperthyroidism, if not treated, they can start developing osteoporosis, increase in your, calcium. One other sign is that's very important is that they'll start having exophthalmos, which is bulging of your eyes from your eyeballs. Periorbital edema is one of the other factors, but periorbital edema can happen both, and also hypothyroidism. Okay. Now, as I said, also I forgot to also mention this in females because thyroid hormone basically affects every cell in the body. It's a metabolic hormone. It's going to affect your GIT, also heat and sensitivity. This is very important because a lot of the patients that do present, they come with signs and symptoms of diarrhea. Okay, some might present with constipation as well, um, amenorrhea, as mentioned here. So they might not basically have their regular cycles. The cycles might be disturbed. Fatigue, muscular sleep disturbance. It basically affects majority of everything in the body, the thyroid itself. Now, if you look at here, the enlarged thyroid, if we go back to the thyroid axis as I was showing you before, now when we say there's an enlarged thyroid, it can happen both, which is a goiter. It can happen both in a hypothyroidism as well as hyperthyroidism. Why? So you see this thyroid here. If it's secreting less of thyroid, it will give a negative feedback to the pituitary gland, okay, which is here. The pituitary gland itself will secrete more of TSH, and it will cause the thyroid to hyper, meaning become more. But the thyroid itself isn't functioning really well. So it's going to become enlarged, okay? Just trying to explain to you how this whole process is working. A lot of patients they do have sleeping issues. Muscular weakness can happen both. Okay, it can happen in um, hypothyroidism as well as hypothyroidism. Okay, hair issues is there, skin issues are also there. Okay, now, when we go to hypothyroidism means that there's less thyroid. Okay. So when there's less thyroid production by the thyroid gland, it will present in the labs as the lab values will be less. Okay. What are the signs and symptoms of hypothyroidism is that you're going to have weight gain. All right. So as in hyperthyroidism, patients are going to start having less of they'll have weight loss. But in hypothyroidism, patients will have more. They'll have weight gain. They'll have hair loss. They also have amenorrhea, female issues within their, menstrual cycles. Patients might present with diarrhea. They might present with constipation. Also, the lab values is they might even present with hypercholesterolemia, meaning high cholesterol levels. Periorbital edema means that they have swelling around their eyeballs, as I mentioned. Um, One other things I wanted to mention is that in hypothyroidism, patients might also present with anemia. There's different types of anemia that patients might have is microcytic anemia or macrocytic. Also, the skin in hypothyroidism patients are very dry. Okay, and one of the typical signs is that the skin will be orange in color. Okay, the fatigue. One thing is very important here is that increased sensitivity cold. If a patient has hyperthyroidism, meaning high production of thyroid, when they go out into the heat, they'll be basically having too much of um, it'll be heat outside, but they'll feel too hot. In patients with hypothyroidism, they'll increase sensitivity to cold, so they'll feel cold even, in when the temperatures are close to around 37, 38. Okay, and constipation, dry skin, as I mentioned, and weight gain. Okay, the puffy face can happen both in hypothyroidism or in hyperthyroidism. And muscular weakness, as I just mentioned to you before, elevated cholesterol levels. This is why whenever a patient has thyroid issues, he or she should always have his lipid profiles done. Um, Now, thyroid nodules. Now, thyroid nodules itself is small little glands. Okay, so patients might present with small little, they might feel irritated in their throat. They have a little bit of, the cough, persistent cough. They might have a little bit of difficulty in breathing. Some patients might have just a persistent cough, even they don't have any respiratory symptoms. They'll just have mild cough, continuous mild cough. Apart from this, mm, one more thing I wanted to mention in the thyroid nodules that it's very important that you see a physician, okay? Whenever you have any type of either swelling in the neck or you feel a persistent cough and you show your GP, he gives you cough medication and you're not getting better. Continuously, you're having like mild cough or you're having shortness of breath even or hoarseness of voice. It's best to go show the any GP or talk to a doctor so he or she can advise you what to do next. Okay. Thyroid cancers. Now, these basically, again, very, it's a little difficult for me to explain to you over teleconsultation, but um, usually around thyroid glands, basically, they're basically divided into like four types. They're papillary, there's mammillary, follicular, and athletic. But if you do have any type of swelling in the neck, or you have any pain in the neck, difficulty in swallowing, you feel shortness of breath, then you need to actually go see a physician. He or she can examine you, trouble in swallowing, any of the following, okay? As I just mentioned to you before, if you look at the thyroid nodule and the cancer, it's very difficult for us to differentiate on physical examination. So the doctor does need to do a FNSE, basically a fine needle aspiration, do a biopsy to rule out if there is a difference between a cancer or nodules. Um, 90% of the time, if there is a thyroid nodule, it can be excised and you should be fine within the next few months of treatment. Okay. How do we do, all of these, the thyroid cancer, thyroid nodules, hypothyroidism, how do we basically diagnose them? So, first of all, we need to do a physical examination. Um, Physical examination, like you will see periorbital edema, you'll see a puffiness in the face. You can actually see a goiter, and goiter means enlargement of the thyroid gland itself. That needs to be done either going to the physician itself. Initially, it should be first, you should do a blood test. What blood test? A TSH. These are the thyroid stimulating hormone and the FT3 and FT4. The first slide I showed you, the hypothalamus pituitary axis, was basically the first slide I showed you was because it's very important. The TSH will basically determine if there is a thyroid dysfunction. Okay. If this is irregular in anyone's lab reports, he or she should then get a FT3 and FT4. This will differentiate. If the TSH is high, that means that it's hyper working, meaning that it's working above normal, that because the body's not producing enough of the thyroid hormones. After this is done, then the doctors might also do autoimmune antibodies test. Okay, because sorry, I'm going to move this to the side. Now, these antibodies test is the TPO and the TSH receptor, the TSI antibodies. They're very important to do because majority, 90% of the cases are more autoimmune. Uh, if there is a patient who has hypothyroidism, meaning the T3, T4 are less than normal, the doctor will actually advise you to get an autoantibody test done because you might develop Hashimoto thyroiditis or you might have hyperthyroidism, which is an autoimmune as well. Um, just briefly, I'm just going to mention this, okay? Okay. After you're diagnosed with a hypo or hyperthyroidism, the next step is to do a imaging test. You can do an ultrasound. The doctor will actually advise you to do an ultrasound just to make sure that there's no nodules or there's no cancer. Okay. And if there is um, hypertrophy of the thyroid gland itself. This will then the next step will the doctor will do is that they'll do a fine needle aspiration. Okay, they'll take a small biopsy to rule out there's no cancer. Um, this is the next step. Basically, the main why am I basically talking about this is that so you know, or if anyone does have anyone in the family or they want to basically have their test done, it's A, B, C, D. First, you go for blood physical examination, do your blood test. After, if the blood tests are irregular, auto antibody test, then do an ultrasound to rule out if there's any malignancy or any cancer. Okay. I'm just going to briefly touch on the treatment of the thyroids. Okay, if anyone has or if a patient has hyperthyroidism, we have antithyroid medications. Okay, these are the azoles and the propylthiouracil. They basically, if anyone has high production of thyroid, they basically regulate the thyroid hormone and normalize it. Radioactive iodine ablation in the thyroid and surgical thyroidectomy. This is very important as well because sometimes um, this is something I want to basically touch upon is sometimes you can have thyroiditis. Thyroiditis means when there is inflammation of the thyroid itself. Okay, uh, it could actually present as both as hyperthyroidism or even hypothyroidism. Are you guys, everyone online with me yet or no? Are you understanding this? One thing you need to understand is that sometimes when you do have hyperthyroidism, meaning high production of thyroid, or there's a low production of thyroid, it's mandatory the physician does not start you on medication. Sometimes you do have in the thyroid gland inflammation, okay, thyroiditis. All the physician needs to do is put you on NSAIDs, non-steroidal anti-inflammatory, and the thyroid hormone, it becomes into normal, right? It becomes normal. So right away, it's not necessary that you do have irregular thyroid hormones or the TSH is high and you starting like yourself on medications. If there's an individual, sorry, if there's a patient, he has hypothyroidism, there's less of thyroid production. We can start the patient on, synthetic thyroid hormones, but it's best to wait for a few weeks to a month, look at the thyroid levels again, start the patient on NSAIDs, non-steroidal anti-inflammatories, have your test done, and then start on medication. One more thing I want to actually mention is that in the thyroid hormone itself, you need to understand lipid profiles are very necessary. As I mentioned in the first slide, it metabolizes your entire body, every cell in the body. If you look at a lot of the bodybuilders, they're taking T3 because they're using it for weight loss. Okay. Um, Also, you need to have your blood sugar test done regularly. Okay. Apart from that, always, anyone who's having any weight loss, any weight gain, they're having palpitations, any fatigue, lack of sleep, first go see your physician. He or she will be able to, help you accordingly. Um, Apart from that, if you do need any advice, our main, the reason for this lecture was to basically just give you guys a brief idea about the thyroid itself. And in TruDoc 24/7, we have this application. If you want to download it, there's always a physician available. There were 24 hours, 7 days a week. There's always a general physician. Um, they're always there. So you can just download the application, either do a video call or audio call and talk to the physicians accordingly. Um, Within this applications, what you can do is this, and if you do have any issues, accordingly, like if you're having weight loss or weight gain, you can ask the doctor, doc, I'm having this symptoms. I need to do this accordingly. So the doctor will actually take a brief history. You can do a video call, talk to the physician, and they'll order the test online. Within the next 1 or 2 days, we have a lab that we have, in coordination with, and we'll send the lab to your house for a blood test. After the blood test, the doctor will, assess you. Again, with the thyroid, it's something that's very, complicated, and you can't just start medications, hormones, right away. Um, and it needs to be monitored regularly. So initially, if somebody does have any thyroid issue, um, it needs to be monitored by the doctor monthly. Okay, so the TSH, the FT3 should be monitored monthly. Um, just to let you know, I had a patient just last week. He was basically having hypothyroidism. Okay, so hyperthyroidism. His thyroid was too high, so he went and he had radioactive ablation. So they removed a majority of his thyroid. Now he's hypothyroidism, so he needs to be on thyroid, but the thyroid medications needs to be adjusted accordingly. Understand? So you can start off on 25 micrograms and 50. Sometimes the patient needs more or less. Okay. I hope this helps. If you guys have any questions, please do let me know. Right. Can hyper or hypothyroidism be corrected through surgery? Hyperthyroidism, yes. Hypo, no. Um, Hypo, why? Let's go back to the first slide. If there is an overproduction of thyroid hormone from the thyroid gland, we can actually remove some part of the thyroid and basically correct the thyroid hormone. So yes, through surgery, yes, we can. Hyperthyroidism, yes, we can. Hypo, it's not. Is there any way to prevent hypo and hypothyroidism? Yes, you can. Yes, monitor your thyroid regularly. Okay. Um, as I mentioned to you in the third, fourth slide, is it's autoimmune. It's genetical as well. So yes, having a good iodine salt, which is very necessary because that basically, if you go into the physiology, we need iodine to convert into active thyroid hormone. Okay. Okay. For someone who has been hypo for 25 years, is taking recommended to thyroid first thing in the morning or evening? First thing on the morning on an empty stomach. It's recommended to take it a half hour early in the morning. And how much are you taking of your thyroid? Are you taking 2,500? Depends on 20, 75. 1 second. So many questions. If I can't lose weight even through exercise or diet, is there symptoms of thyroid? Yes, it could be. What you need to look, if you do have any weight gain and you're not able to lose weight, right? Go to your physician, have your TSH done. There's no need for you to do the whole thyroid profile. Just tell them, can I please have my TSH done? The thyroid stimulating hormone, which is from the pituitary gland. Have that done. All right. I'm having a question. What would be the side effect of total thyroidectomy? That's a difficult. Now, the thyroid gland is basically here. Behind the thyroid gland, we have parathyroid gland, which basically regulates the calcium. So, if anyone who's basically having a total thyroidectomy, they need to be on calcium and vitamin D, right? Right. How do we take precautions from hypothyroidism? And how do we take precautions from a hypothyroidism? We do a thyroid screening. We monitor the thyroid initially, okay? In a new thyroid. Basically, when a child is born, we monitor his or her thyroid profile and 75 micrograms. Yes, if you're taking 75 micrograms, are you having your thyroid function test done regularly or every 3 to 6 months? Have your thyroid profile done regularly, have your lipid profiles done regularly, and your fasting blood sugar. Unknown, oh my God. What does it mean when T4 is high but T3 and TSH is normal? Hmm. TSH, T4 became normal, but a few symptoms of swelling. There again, remember, I explained this to you before. Whenever you have anyone who has abnormal TSH, TSH is normal, meaning the thyroid stimulating hormone is producing enough of um, uh, the thyroid gland isn't basically producing enough of the thyroid. This gives a negative feedback to the pituitary. If the pituitary is not giving high TSH, that means yes, your thyroid function is within normal limits. You repeat the thyroid test after 1 to 2 months. Mm, right. MM, did I answer your question? Okay. Um, A thyroid blood test came normal, but there's a few other symptoms: swollen throat, weight gain. Should we do other tests to confirm? Thyroid function came normal, but few other symptoms: swollen throat, weight gain. Yes, there's other factors you need to look into, like diabetes. Look into your fasting blood sugar. Have your fasting blood sugar done, and it depends on your age, any family history, any other signs and symptoms you need to look into. Sorry, I just joined a few minutes. Can I? How, how is thyroid and weight gain connected? Right. Okay. AG. I'll just repeat where I've said. Are there any foods or anything that you can drink predispose us to hyperthyroidism? There are some medications, okay, that they predispose you to. They can actually disrupt they can cause you to have hypothyroidism. Some of antihypertensive medications, lithium, they can cause hypothyroidism. Multiple other medications that they can actually cause hypo or hypothyroidisms. So that's why it's very, very necessary that you go see a physician before taking any medication. Sorry, I joined a few minutes late. If you're having hypothyroidism, it's one of the signs that you can start having weight gain. Thyroid itself is a metabolic hormone. So if it's working less than normal, your metabolism is slow, and you'll start gaining weight. And if that answers your question, okay. All right. If you guys have any questions, you guys can download the application. There's always a physician available. They will be able to answer your questions. If you have any questions related to any other issues, not even thyroid, any problems that you have, if you have hypertension, any other chronic medications you need a refill for, you're welcome to download our applications, and a physician will be able to help you. Okay. Thank you so much. Is there anything else I can help you with? Thank you. Take care. Bye.